It sounds like you like some help with creating music using a dig.
Diabetic mellitus is a chronic medical condition that affects how your body turns food into energy, specifically how it manages blood sugar, glucose. There are two main types diabetic mellitus. 1. Type 1 diabetes. The body does not produce insulin. Often diagnosed in children and young adults. Requires lifelong insulin therapy. 2. Type 2 diabetes. The body either doesn't produce enough insulin or the cells don't respond properly to it, insulin resistance. More common in adults, but increasingly seen in children due to lifestyle factors. Often managed with diet, exercise, oral medications, or insulin.
It sounds like you like some help with creating music using a dig.
Key symptoms of diabetic mellitus. Increased thirst and urination. 1. Diabetes mellitus, type 1 or type 2. High blood sugar levels cause excess glucose to spill into the urine, pulling water with it. Common symptoms: fatigue, blurred vision, weight loss, frequent infections. 2. Diabetes insipidus. A rare disorder where the body can't properly balance fluid levels due to hormone imbalances, ADH. Leads to large volumes of dilute urine and intense thirst. 3. Excessive fluid intake, psychogenic polydipsia. Sometimes linked to psychiatric conditions or habit. Leads to increased urination due to high fluid intake. 4. Kidney disorders. Some kidney issues reduce the kidney's ability to concentrate urine. 5. Diuretic use or substances. Caffeine, alcohol, or diuretic medications can cause increased urination and possibly thirst due to fluid loss. 6. Electrolyte imbalances. Especially low potassium or high calcium can disrupt fluid balance. If you or someone else is experiencing these symptoms, especially alongside fatigue, weight changes, or blurred vision, it's important to see a healthcare provider. They may run blood tests, like fasting glucose, HbA1c, electrolytes, and urinalysis to determine the cause. Fatigue generally refers to a state of extreme tiredness or lack of energy. It can be physical, mental, or emotional, and it often doesn't go away with rest. Here are some common causes and categories. 1. Physical fatigue. Lack of sleep or poor sleep quality. Overexertion from exercise or physical labor. Illness, example flu, anemia, thyroid disorders. Chronic conditions, example fibromyalgia, diabetes. 2. Mental/emotional fatigue. Stress or burnout. Anxiety or depression. Emotional overload, such as from grief or trauma. Decision fatigue, too many choices or responsibilities. 3. Lifestyle-related fatigue. Poor diet, nutrient deficiencies, dehydration. Excessive caffeine or alcohol. Irregular routines. Sedentary lifestyle. 4. Environmental/work-related fatigue. Long hours or shift work. Poor ergonomics. Noisy, stressful environments. If fatigue is persistent, unexplained, or disrupts daily life, it's important to see a doctor. It might indicate an underlying health condition. Blurred vision can be caused by a range of issues, some minor and others more serious. Common causes include: 1. Eye strain or fatigue, often from excessive screen time or reading. 2. Refractive errors, like nearsightedness, farsightedness, or astigmatism. 3. Dry eyes, can make vision intermittently blurry. 4. Eye infections, such as conjunctivitis. 5. Migraine, often includes visual disturbances. 6. Diabetes, high blood sugar can temporarily blur vision, diabetic retinopathy can cause lasting damage. 7. Glaucoma or cataracts, can cause progressive blurring. 8. Retinal detachment or macular degeneration, more serious causes that require immediate attention. 9. Medication side effects. Certain drugs can cause blurred vision. 10. Neurological issues, such as a stroke or multiple sclerosis. If your blurred vision came on suddenly, is worsening, or is accompanied by other symptoms, like pain, headache, weakness, or loss of coordination, seek medical attention right away. Slow healing wounds can be a sign of several underlying issues and should be evaluated seriously, especially if they persist for more than a couple of weeks. Here are some common causes. 1. Poor circulation. Peripheral artery disease, PAD, or venous insufficiency can limit blood flow to the wound site, slowing the healing process. 2. Diabetes. High blood sugar levels impair immune function, circulation, and nerve health, which can delay wound healing and increase infection risk. 3. Infection. An infected wound may not heal properly or may worsen. Signs include redness, warmth, pus, swelling, and increasing pain. 4. Nutritional deficiencies. Lack of protein, vitamin C, zinc, or iron can impede tissue repair. 5. Medications. Corticosteroids, chemotherapy, and some blood thinners can interfere with the healing process. 6. Age. Older adults often have slower cell regeneration and circulation, making healing more difficult. 7. Smoking and alcohol use. These habits reduce blood flow and impair immune response, both of which are crucial for healing. 8. Chronic conditions. Conditions like kidney disease, liver disease, or autoimmune disorders can also affect wound healing. Unexplained weight loss, especially in type 1 diabetes, is a common early symptom and occurs due to the body's inability to use glucose for energy. Here's why it happens. Causes of unexplained weight loss in type 1 diabetes. 1. Lack of insulin. In type 1 diabetes, the pancreas produces little or no insulin. Insulin is necessary for glucose to enter cells from the bloodstream and be used for energy. 2. Energy deficit. Without insulin, glucose builds up in the blood but can't be used by cells, so the body starts breaking down fat and muscle for energy. 3. Increased urination. Polyuria. High blood sugar leads to excess glucose in the urine, which drags water and calories out with it, causing both dehydration and calorie loss. 4. Muscle breakdown. In the absence of glucose utilization.
It sounds like you like some help with creating music using a
The relation of age and diabetic mellitus. Age is an important factor in the development, management, and outcomes of diabetes mellitus, DM. Here's how age relates to diabetes. 1. Type 1 diabetes and age. Typically develops in childhood or adolescence, but can occur at any age. Caused by autoimmune destruction of pancreatic beta cells. Requires lifelong insulin therapy. 2. Type 2 diabetes and age. More common in adults over 40, but increasingly seen in younger individuals due to obesity and sedentary lifestyles. Often associated with insulin resistance and relative insulin deficiency. Age-related factors such as decreased muscle mass, reduced physical activity, and increased fat distribution contribute to insulin resistance. 3. Aging and risk factors. With age, the risk of glucose intolerance increases. Older adults often have multiple comorbidities, e.g., hypertension, dyslipidemia, that compound diabetes risk. Aging-related decline in pancreatic function and insulin sensitivity plays a role. 4. Management considerations in older adults. Individualized treatment goals, less stringent A1C targets if there's a risk of hypoglycemia. Attention to cognitive function, risk of falls, kidney function, and potential drug interactions. Focus on quality of life, avoiding overtreatment and hypoglycemia. 5. Screening and prevention. Routine diabetes screening is recommended starting at age 35, or earlier for high-risk individuals. Lifestyle modifications, diet, exercise, are especially beneficial in older adults with prediabetes.
It sounds like you like some help with creating music using a digital.
Natural management of diabetic mellitus. 1. Diet and nutrition. Diet is the cornerstone of natural diabetes control. Low glycemic index, GI, foods, focus on whole grains, quinoa, oats, legumes, and non-starchy vegetables. High fiber diet, fiber slows down glucose absorption. Good sources include leafy greens, beans, lentils, flax seeds, and chia seeds. Healthy fats, incorporate nuts, seeds, avocado, and olive oil. Limit refined carbs and sugars, avoid sugary drinks, white bread, and processed snacks. Cinnamon and fenugreek, these spices may improve insulin sensitivity, in moderation. 2. Physical activity. Regular exercise improves insulin sensitivity and glucose uptake. Aerobic exercise, brisk walking, cycling, or swimming for at least 30 minutes, 5 days per week. Resistance training, improves insulin response and muscle mass. Yoga and Tai Chi, can reduce stress and support blood sugar control. 3. Stress management. Chronic stress can elevate blood sugar via cortisol. Mindfulness meditation. Deep breathing exercises. Adequate sleep, aim for 7 to 9 hours of quality sleep. 4. Herbal and natural supplements. Always consult your doctor before using supplements. Berberine, shown to lower blood sugar comparably to metformin. Bitter melon, contains compounds that mimic insulin. Aloe vera, some studies suggest it reduces fasting blood glucose. Gymnema sylvestre, may reduce sugar cravings and improve insulin function. 5. Hydration and lifestyle habits. Stay hydrated, water helps the kidneys flush excess sugar. Avoid smoking and limit alcohol. Monitor blood sugar levels, track your response to foods and routines. 6. Regular checkups. Even with natural methods, regular medical checkups are essential to monitor A1C, kidney function, and other diabetes-related risks.
It sounds like you like some help with creating music using a digital.